Alright guys, it's Louis here from ndxtesting.com, and in today's video we're going to speak about high blood pressure. But we're going to speak about it in a different way, because the majority of the problem that I see, right, with physicians, especially when I had this problem with anxiety and high blood pressure, that most of the time they're trying to treat the symptoms instead of trying to understand the root cause. So I think that with high blood pressure, we need to really understand our bodies, the way our cardiovascular system works, and the way our bodies communicate. Remember, we're not born with high blood pressure. At least when I was in my 20s, I did not have it. When I was in my 30s, I did not have it. When I was in my early 40s, I did not have it. It's only when I turned 47 that all of a sudden my life just sprung out of control. I developed anxiety, a rapid heart rate, and high blood pressure. And when I went to the doctors with these symptoms, they couldn't tell me why. And I was a little surprised, because I am in the medical field, and usually I do nerve examinations for a living. So my specialty is the field of electrodiagnostic medicine. I specialize in nerves and muscles. And I usually, when something's going on with one of the patients that I see, I try to identify the root cause. So it's not about treating symptoms, it's getting to the why this is happening. And most often what I see and what I hear is they use the word genetic disposition like it's nothing. And let me just say something. If you do not have diabetes at 20 or at 30, and all of a sudden you're in your early 40s and you end up with diabetes, do you really think that it's a genetic disposition? I mean, your genes can play a role, but they're not your destiny. Usually what happens is that it's your poor nutritional choices. You did it to yourself. And that's why you end up with diabetes and high blood pressure, anxiety. What I have learned in the last 3 years, that there's only two major reasons for high blood pressure, anxiety, and a rapid heart rate. And the rest, the 10%, right? The 10% of the people that have high blood pressure is because of disease. And if you have a disease, you will know. And also mental. Now, when I was diagnosed with high blood pressure, and I just found out, I didn't have a disease. There was nothing wrong with me. And they did all kinds of exams. And their answer was, you have a genetic disposition, which I completely dismissed that. I don't have any genetic disposition. And they thought it was mental. You need to see a psychiatrist. That was their answer. In the meantime, the answer was right in front of them, because I was telling them what was going on. I was telling them, listen, there's something going on in my sleep, because I wake up in panic mode. I wake up, I go to sleep, fine, maybe a little bit of anxiety, but then I wake up more anxious. I wake up with a rapid heart rate. I wake up with high blood pressure. Why? Their answer was, well, that should never happen. When you go to sleep, you should wake up fine. And these are medical professionals. But anyway, I'm gonna go and show you some video slides and give you guys the two main reasons why I got sick. Thankfully, I feel 100% now. I have zero anxiety. My blood pressure is out in control. But also, the purpose of this channel is to give you digitized information so you can be healthy. Because now, with digital technology and wearables, we can find out exactly what's going on with our bodies, and then we can make the necessary adjustments. But there is work for you to do. So once we understand the way our bodies work, then we can make the adjustments. For instance, if you have high blood pressure, then you need to understand the root cause. If you understand the root cause of high blood pressure, if you understand the way your cardiovascular system works, you will know exactly what you need to do. Now, you don't know the root cause, so you're not doing anything about the root cause. The physician that is treating you, they went to school for 10, 12 years where he's not telling you a root cause. And he's just there to give you medication. And there's nothing wrong with taking medication, but at the same token, you need to find out exactly what is the root cause. That's what I did. I mean, I took some meds at the beginning, but I'm like, hold up a second. I'm not taking medication for anxiety and for high blood pressure for the rest of my life. I want to know what the heck, why is this happening? I was fine before, and all of a sudden, I don't feel fine. Nah, something. And I wasn't overweight. I was in tip-top shape. I'm 5'8", 170 pounds. Even back then, I even lost a little bit of weight because I was so anxious, I couldn't eat. And I couldn't live my life like that. It's like, I don't think so. I need to find out exactly what's going on. But let me tell you something. Do you think that it makes sense that in one way there's something going on with your body that's giving you high blood pressure and is giving you anxiety? So you have this shooting up, and all of a sudden you take medication, and you have the medication and the root cause fighting against each other. Do you think that that's the cure? The medication is not the cure. The medication is only going to make the numbers look nice. We need to understand how to take care of our bodies. Okay, we need to maintain our bodies new. Okay, we need to take care of our arteries, and today we're going to discuss this. I'm going to show you guys a video slide, and we'll take it from there. It's important that we understand a little bit of why we get the high blood pressure. Now, when we get high blood pressure, right, what happens is that the arteries are narrow, and that's why the pressure on blood pressure increases. So look at the arteries here on the left-hand side. There's nothing wrong with it. Blood can flow freely, and you want to have high blood pressure. That's the way we are born. Now, what happens now? We have high blood pressure. Why do we have the high blood pressure? Well, there's two major reasons why our arteries get narrow. And we're going to discuss the first one in a couple of minutes. So our objective when we have the high blood pressure is to open up the walls of the arteries. But we have to find out the root causes of why these arteries are being narrow. And there's only two major reasons. The other two are disease, which we will know if we have a serious disease, and then it's mental. Mental, sometimes it can give us a level of stress that it can affect our arteries over time, but that when it's mental, it's really, really serious. I'm talking about beyond. Okay? And that's only 10%, but the 90% is because of what we're going to discuss. So we are born with healthy arteries, and then all of a sudden, once you get into like maybe late 30s or mid 40s, then our arteries start to look like number 2. So somehow our nutritional choices were not good. Maybe our lifestyle was not effective. I know with me, I had a problem, and then that must have been that my arteries got a little bit narrow, and that's why my blood pressure rose. And so my objective was to open up the walls of my arteries with good food and find out of why my arteries got somewhat narrow. But we were born with healthy arteries, and then somehow after 30s and mid 40s, then we get arteries here number 2. The reason you have a high blood pressure is because number 2 here, your arteries are narrow, and we have to find a way to kind of open up the arteries a little bit. And let's discuss reason number 1 of why the arteries get narrow. Okay, guys, so on the right-hand side, we have subcutaneous fat. The subcutaneous fat is the fat that is your skin fat, the fat that you can pinch. So if you can grab a lot of that fat, then that's not good. You want that fat to be a little bit tight, but that fat is actually not dangerous. Okay, then you have your stomach here. You have your inner walls of your stomach. You have your organs in the inner walls of your stomach, and then you have the abdominal cavity that's in between the visceral fat and the subcutaneous fat. So now the visceral fat, okay, which is right here in the middle, that's the dangerous fat. Now, we're not born with that fat, but obviously within time and perhaps with our poor nutritional choices, then we develop a lot of this fat. So when we have excessive fat, and the way we know we have excessive fat is if you are a male over 40 and your waistline is more than 40 inches, and the way you measure your waistline is at the level of the belly button. So if your waistline is more than 40 inches, then you could be in danger of developing this type of fat, and that's not good. Obviously more than 40, 42, 45, that's not good. So you want to measure your waist, and if you have over 40, you have to start working on that, because that could be really bad for your health. And if you're a woman over 40 and your waistline is more than 36 inches, then it's actually, when you do your research, it says 35. I say 36 just to kind of deal with the margin of error. But I think 36, definitely at 36 or more, you have dangerous visceral fat. So now with this visceral fat here, with this unnecessary belly fat that you have, you're going to have more of a gut. So when you have more of a gut, what happens? It compromises your organs. And then you could develop a fatty liver. You can develop kidney disease or kidney stones, gallbladder issues. You could develop gallstones, colon issues, small intestine issues. And then you go to the doctor, they're not going to tell you why you have these issues. They'll lose some weight, but they have to know that it's the visceral fat that's getting the person in trouble, because this fat is compromising your organs. So when this happens, it releases dangerous toxins into your bloodstream, and then that's going to make your blood pressure rise. That's going to give you anxiety. That's going to give you a rapid heart rate. It's going to give you cardiovascular issues. Over time, it can give you heart disease, diabetes. So we can't have that. And we already mentioned the ones on the left: the liver, the kidney, gallbladder, colon, small intestines. So you have to reduce that type of fat. If you take care of your gut, you're going to be a lot healthier. Now, this unnecessary belly fat, guess what? It affects the central nervous system, which is your brain. If you have a healthy gut, then you're going to be able to think a lot better. You're going to have more energy. Your metabolism is going to be better. Your immune system is going to be better. You won't get as sick as much. So you got to be able to take care of your gut. All right. So one of the best ways that you can reduce excessive belly fat is nitric oxide. Those are the two key words, and I need you guys to do research on that. Okay. So spinach is high in nitric oxide. One of the things that I take is I take beets powder juice. That it's high on nitric oxide. You mix it with your favorite. I usually mix it with cranberry juice, and that's good. That's going to help you reduce some of that belly fat. And you have green tea. It's good for belly fat. If you drink water early in the morning, temperature water, before you eat breakfast, that's going to clean out some of the toxins that you have in your body. I think we have a short video on the 8 benefits of drinking water early in the morning. And so you got to take care of your gut. You take care of your gut, you're going to be a lot better. So definitely do some research on that, and you're going to feel a lot better for sure. But this is one of the reasons why people have these issues of high blood pressure and anxiety, and they go to the doctors. And then what do you think is going to happen? I think I mentioned it too on the video. So they're going to give you medication. Doctor gives you medication. You have a waistline of more than 42 inches. So now you have the medication going into your bloodstream, but now you have dangerous toxins going into the bloodstream. Most of the time, the medication is not going to work. Then they're going to give you a higher dosage. When we take higher dosage, then it's not good. It has more side effects. In fact, Pfizer just came out with a recall blood medication because the side effects are cancerous. So they had to remove it. They had to recall this blood pressure medication. I can't remember the name, but I saved the study, but I don't want to. You guys can research it on your own, and you'll see. But a lot of these medications have side effects. I'm not saying, listen, guys, don't take your medication. I mean, I have taken medication, but at the same time, I want to find out the root cause, take care of my health, so the medication could work a lot faster, and then I could take vitamin D3. I could take other stuff, all the natural elements that can reduce my blood pressure. But one thing that I'm not going to have is dangerous toxins going into my bloodstream. So whatever I do, the medication, the vitamin, things are going to work a lot faster, a lot better. But we can't have this. This is one of the main reasons why people have high blood pressure. So now let's discuss the other reason why people have high blood pressure. Remember, it's the visceral fat. The second one that I'm going to discuss, it counts to 90% of why the two combined count for 90% of why people have high blood pressure, anxiety, rapid heart rate, sleep apnea, and other issues, cardiovascular issues. The rest is just 10%. And the 10% is mental. That's one of the reasons when I went and I was diagnosed with these symptoms, they thought that I was crazy. They was like, you got to see a psychiatrist because there's nothing wrong with you. They thought that I was doing it to myself. It's not. No, my body. It's affecting my mind. It's not my mind affecting my body. They didn't know. Now I didn't have this problem. I had another problem, which is problem number 2 that we're going to discuss right now. So mental, and then we also have disease. Disease can increase your blood pressure and can give you all sorts of problems. But if you have a disease, you're going to know you have a disease. So that's why people get sick. Disease, it's be mental, and then the rest, the 90% is dangerous visceral fat, and we're going to discuss the other one now. The second problem, this is a problem that I had. So when I went to the doctors and I had high blood pressure, anxiety, rapid heart rate, they couldn't tell me why. And you guys already seen lots of videos, but the reason I was having these issues is because I was a mouth breather. So when you mouth breathe all your life, not only is it going to affect the shape of your face, that's why one of the best advice that you can give your kids, for those who have young kids, even teenage kids, you got to breathe through your nose, because if you don't breathe through your nose, this is exactly what you're going to look like. A mouth breather. A mouth breather will develop poor definition of cheekbones. Let's go to the left here first. Tired eyes, crooked nose, open mouth posture will give you a receding chin. So usually there's nothing wrong with the size of our jaw. What happens is when we mouth breathe for like all our lives, then the jaw is going to be positioned all the way back. So that's going to restrict your airways. And then later on, when you get older, then you're gonna have some issues. You develop a narrow face. So anyway, without getting too much into the situation, it's going to affect the shape of your face when you breathe through your mouth, and that's not good. So one of the best advices that you can give your kids is to breathe through their nose so they can develop a nice, well-rounded face. And as adults, then we're going to get in trouble because it's going to affect our cardiovascular system. It's going to affect our blood pressure, anxiety. We're going to develop sleep apnea. Why? Because we develop sleep apnea. Why do we develop sleep apnea? Look at this picture here. We develop sleep apnea because our jaw is positioned all the way to the back of your throat. So when you sleep on your back and you open your mouth, what do you think is going to happen? It's going to block your airways, and that was my problem. See, I did it to myself. I mean, I didn't look exactly this bad, but let's just say that very similar. I didn't look like picture number 1 here. Nobody ever told me, Louis, please, you have to breathe through your nose. I was a mouth breather all my life, and then next thing you know. But when you breathe through your nose early, okay, you're going to develop a nice facial structure. Straight nose, close your mouth posture. You're gonna be able to close your mouth a lot better. A nice chin. Your chin's going to develop. Your chin's going to come out, okay, the way it's supposed to. So you're going to have a better aligned face. But anyway, I wanted to show you guys this picture because if you look similar to picture number 2, that means you've been a mouth breather. When you breathe through your mouth, you're going to develop sleep apnea. You're going to develop diabetes. You're going to develop high blood pressure, rapid heart rate. You're going to develop a lot of issues. And if you have then visceral fat, if you're overweight, then you're going to have 2 giant issues going in affecting your body, and the doctors are never going to tell you why. I only had case number 1. I was a mouth breather. That's why I got myself in trouble. But once I realized, oh man, you know what? This is why this is happening. Then I changed. I became a nose breather. Definitely. Overnight, my blood pressure, my anxiety levels went down. I felt 75% better once I started breathing through my nose. But so I'm showing you this so you guys can see for yourself. So over time, if you breathe through your mouth, what is that going to happen? So let's find an article here. Let's talk about this for a second. So here, the second part here, right? When it comes to mouth breathing. So mouth breathing causes bad breath, okay? Poor sleep, early aging, gum disease, and high blood pressure in adults. And according to the Healthline, mouth breathing can also lead to crooked teeth facial deformities like we've seen previously. I mean, we saw an overbite, but sometimes the face can get really, really affected. Poor growth when it comes to children. And once you get into the habit of mouth breathing, it can be very difficult to stop. So you have to probably seek a little bit of help, maybe an ENT doctor or a dental sleep medicine, a doctor that can maybe give you a dental device. But anyway, so those are the two major reasons, without just keeping it simple. So the visceral fat, the unnecessary belly fat that you have in your stomach would definitely narrow your arteries, and it will cause high blood pressure and a lot of different cardiovascular disease. And then mouth breathing. It's a silent epidemic that is affecting millions of people, and it affected me. I saw early symptoms in 2007. Like I mentioned in my video, I was waking up out of breath. I guess I would stop breathing and I would wake up. That's one of the symptoms of sleep apnea, but mouth breathing leads to sleep apnea, because the mouth breathing, you develop an overbite, and then the overbite, the position of your jaw, it's all the way against your throat. So when you sleep on your back and you open your mouth, guess what? Your overbite is going to kind of narrow the airway, and then you won't get enough oxygen going into your brain, and that's why you wake up. So breathing through your nose is extremely important. So once I started breathing through my nose while I was sleeping, then it was a challenge, but I definitely got a lot better. So one of the things that I'm going to do now, I think I mentioned in one of my shorts video, is I'm going to see a sleep medicine dentist, and he's going to make me a dental appliance, just since I have an overbite, just to make sure that when I sleep, my jaw, my bottom jaw is pushed forward a little bit, so my airways don't get narrow. But if you take care of your gut, and if you take care of how you breathe, you're going to be fine. In the channel, I'm giving you guys a lot of different solutions. If you have high blood pressure, the best doctor you can go to is a cardiologist. And if you have sleep apnea, you go to an ENT doctor. And then associated with that, you can go with a sleep medicine dentist, that he can make your dental appliance. And if you have an overbite, like we saw in the pictures, if you're young or even older, if you have good bone structure, then maybe you can they can fix your bite. And if you fix your bite, then you're going to be fine. But anyway, guys, I think that's it for today. I think this is a pretty a good video. We have a lot of good stuff coming on the channel. We're going to be discussing different topics too. And not just health and wellness, but probably we're going to bring in a little bit of basic finance, because when you have health, then you got to make good financial decisions for yourself, and that's about it. So I'll see you guys soon. Let's get back to the other side. All right, guys. So I hope that you found the video helpful. Now, I believe that those are the two reasons why the majority of people in society today are sick, because they do not know how to take care of their bodies. So all I can tell you is that if you take care of your gut, you're going to be healthier. If you be careful of how you breathe. Remember, I have stated this many times, that you can do the best exercises, you can eat the best diet, but if you can't breathe properly, you have nothing. You need to breathe properly. Life starts by breathing, and life also ends by breathing. If you don't take care of how you breathe, you're going to get sick. You cannot breathe through your mouth. Obviously, there are circumstances where people can breathe through their nose, but I said this many times in my channel, you need to go to the proper doctor so they can check if you have any obstruction. So be careful how you breathe. That's going to change your life. Take care of your gut health. And if you do that, you're going to be 90% healthier. So you need to take care of your health. Take care of your gut. Take care of how you breathe. Take care of your posture. Take care of your brain. Take care of everything. Learn how to take care of your body. And that's the purpose of this channel. I know that a lot of people suffer from high blood pressure and anxiety, so we're going to take out more videos. Like I said, if you have any ideas, please write, participate, write it in the comments below. Whatever it is, if you like this video, press a like. If you haven't subscribed, then so I usually never say subscribe, but I'll say it today. Subscribe to the channel. I think that if we work together, this is going to be a good journey. You can live past 100 years old, healthy and strong, if you know how to take care of the body, of your body, and if you pay attention to all the digital information that's out there and the digital technology that we have to make our body strong. With that being said, I'll see you in the next video. Bye-bye.